So I'm not just happy right now because I don't know. I met a lady and we're just talking, and as a medical person, we're just talking things in medical field. And then she told me she had an ovarian cyst before, and they gave her, or she took an antibiotics. She bought antibiotics, and then she took and I was like, why will you take antibiotics for ovarian cyst? And she said her friend once had an ovarian cyst and the doctor prescribed antibiotics for her. I told her it might not be true, because antibiotics is meant for an infection. So you only take antibiotics when they are suspecting infection, and different antibiotics are meant for different infection. Now, ovarian cyst is just a few sac. When you have like a bowl and you have water inside, that's how ovarian cyst is. There are different types. There are some, women, most women ovulate every month, and some don't ovulate every month. So for those who don't ovulate every month, it's not about having fertility issue, no, it's just normal as well. So for someone who does not ovulate that month, for some people, the fluid will continue getting bigger and bigger. And when you go for scan at that period, they might see it as an ovarian cyst, because when they measure and they see that it's above the normal measurement for the egg to rupture, which we call ovulation, and it's not rupturing, they call it a cyst, because it has passed the measurement for it to rupture. So since it did not rupture, it continues getting bigger and bigger. And once you go for a scan, they will pick it as a cyst. That does not mean it's something bad, it's something sinister. No. It does not mean you have to go and take antibiotics for it. No. The only thing you might take is pain relief if it's causing pain. Now, for those ones, it resolves on its own. You don't need treatment. Do you get? You don't need anything for it. Once it's 2 to 3 months, it resolves, and that's it. Now, there are some people who are born with ovarian cyst, and it does not have any problem. They don't have symptoms, they don't have pain, they don't have anything. Some people don't even know. Maybe it might be an incidental finding. Some of them must have even had all their children, and then maybe they went for a scan and they saw it, or maybe something happened, they went for a surgery or something, and they accidentally finds it. And this person was born with it, And there are some that, yes, it can cause problems. So now, how you know is sometimes you feel bloated, you're always having lower abdominal pain, and sometimes if you even press, check your lower abdomen, you might feel like you're pressing on something hard or something like that. And then you go for a scan and they say that it's a cyst, which is very large or has some things inside, debris or whatever it is, and they know it's causing you a lot of problem, it's causing you pain, And then the gynecologist might say, okay, the best option for you is to remove it. Nobody will just give you antibiotics for it to shrink. Antibiotics does not shrink ovarian cyst. They might give you antibiotics maybe when they do surgery and they're suspecting you might, don't want any infection or something. I don't know. I'm not a gynecologist, so I don't know. But I know that they don't give antibiotics. It does not shrink it. So please, let's stop taking medication that we are not supposed to. These antibiotics has caused so many health problems that we are not even aware of. These antibiotics can cause heart problems, kidney problems, liver problems. Let's stop taking it, please. Your friend was prescribed antibiotics does not mean you should go and take that same antibiotics. The thing that's wrong with that your friend is not the same thing that is wrong with you. So you can't take what she's taking until they go through tests and know the exact one you're supposed to take. Please, please, if you're in my country, Nigeria, stop taking antibiotics because you're feeling pain or because someone else took it for what you feel is happening to you. Go to the hospital, do your test, ask questions, see a professional in that field. If it's about your reproductive organs, see a gynecologist, and they will tell you what to do. If you think you need treatment, then they will let you. Please, I'm not happy. When she told me she took antibiotics, we spoke about different things. I was like, let's stop this, please. Okay? Thank you. Bye.